All of that is putting a huge strain on our hospital workers.
That's where News Channel 5 Chief Investigative Reporter Phil Williams continues our coverage. Phil.
Well, guys, as we continue to track the numbers, every day almost brings a new record for hospitalizations. But a lot of people just don't seem to be swayed by the numbers. That's why one Tennessee nurse wants you to see the crisis through her eyes.
Okay, so I guess where to start. We started this fight together. We started staying at home, not going out unnecessarily. As a community, I think that everybody did really well. They fought with us.
If you want to see real COVID fatigue, look into the eyes of Nurse Emily Egan.
And now, I guess they're tired of it. I guess people are tired of being alone or in their homes and want to get out and be social again. And we understand the importance of mental health, but the fight is getting out of hand.
For the past month, Nurse Egan has worked the COVID ICU at Holston Valley Medical Center in Kingsport. As COVID hospitalizations continue to skyrocket across the state of Tennessee, she has seen the faces behind the numbers.
We're losing more than we're keeping. I put an ungodly amount of people in body bags that I wasn't prepared to do, that I wasn't prepared to give up on a patient, but there was nothing else we could do, and we lost them.
Across Tennessee, hospitals are feeling the strain. Sadly, some days the number of available ICU beds depends on the number of people dying.
There's been days that I have lost 2 patients, did their care and got them moved out to the funeral homes, and had to take 2 right back that were equally as sick. I go home, I carry it home, I cry a lot. I cry a lot.
Nurse Egan says she gets that some people don't like wearing masks, that breathing through them isn't always easy.
But seeing these people die that can't breathe, like it starts to take a toll on you. And you feel so frustrated that they didn't take it serious, like I can't tell you how many patients that we've had that they contracted it at a ball game or at a family affair of some sort, some birthday parties or dinners or...
In her case, she hasn't seen her own grandparents in months because these days, she says, require all of us to be willing to make sacrifices.
I'm giving these patients my all. I've sat with them, I've held their hand as they died because family couldn't be here. And it starts to hurt. And if you could just stop one case by wearing a mask or staying home when you didn't have to go out, it would help us so much. Just one case. If everybody did that for one person, I think we could stop this.
Now here's one number that will give you some perspective. As of this morning, there were just 174 ICU beds still available for the entire state. As Nurse Egan said, this is real.